Welcome to Beyond the Paper Gown. I'm your host, Dr. Mitzi Krockover. Today, we're uncovering a critical but often overlooked part of women's health, oral health. So have you ever considered that taking care of your teeth also affects your heart or pregnancy outcomes, and that your hormones can affect your oral health? My guest, Dr. Maria Ryan, Executive Vice President and Chief Clinical Officer at Colgate Palmolive, is here to show us just how connected the mouth is to the rest of the body. We're going to talk about how oral health is part of a holistic approach to medicine, related to everything from chronic inflammation and diabetes to menopause and cardiovascular risk. Yet, dentistry is often siloed from medicine, something Dr. Ryan has been working to change throughout her career, both as a periodontist and a global health leader. Today, we'll learn how those silos are being torn down and how oral health is increasingly, albeit slowly, integrated into general healthcare settings. So whether you're managing dry mouth in menopause or curious about the real impact of gum disease, this episode will give you the tools and motivation you need to take your oral health seriously. Maria, thank you so much for being with us today.
Thank you for having me on your show, Mitzi.
Absolutely. I want to kind of step back because I'm always interested in how people got to where they are and the decisions they made along the way. So you've had a very widespread career. And so what inspired you to even think about dentistry as a profession? And then how did that lead you to all the other things that you've been doing?
Yeah, it's interesting. When I was in college, I knew I wanted to go into the health professions, and I had the good fortune of working during college in a dental office. And I really enjoyed the work, and as I went to dental school in a school that was really part of a medical center, we took our first 2 years of classes with the medical school, and then separated a bit. And that's actually part of the issue we're talking about here, right? Is how medicine and dentistry get separated. And there are many dental schools where they are completely separate. And so I ended up, going into the dental profession, but always because of the educational process at the school that I went to, had an interest about the impact of oral health on overall health and well-being. And much of my research was in that area. I went on to get my PhD. So I've enjoyed the dental profession, and I taught for over 20 years in a dental school. And then I went on to industry, and I'm at Colgate Palmolive now, where we are really leaders in oral health throughout the world.
As you were talking about your training, I trained in medical school at the University of Texas in San Antonio. There was a dental school, and for those who are squeamish, take a few seconds, but our cadavers came without the head and neck because the head and neck were given to the dental students. We literally were robbed of that opportunity to learn more. How are you taking that intersection between health and oral health to your work at Colgate?
Yes. Interestingly enough, we just came out with a white paper with the World Economic Forum, which is looking at health inequities throughout the world and how health is so important to the world's economy. And they actually came out with a zero health gaps plan and pledge to get CEOs all over the country, all over the world, to sign on to the fact that the health of their employees and the communities that they serve is essential for a good economy throughout the world. And sometimes they say if you're not at the table, it just doesn't even get introduced. And so in looking at that plan and pledge, I recognized that oral health was never mentioned in it. And so I asked if we could explore bringing that to the table as well. And we actually started one of the first ever affinity groups in their Global Health Equity Network which is an oral health affinity group. And one of the first charges of that group was to put out a white paper basically talking about the importance of oral health to overall health and well-being, and giving an economic rationale for bringing oral health to the global health initiatives that people have throughout the world. And this is all part of the work also of the World Health Organization right now. They recognize that one of the most common diseases in the world are oral diseases. More children suffer from cavities than any other disease. And more adults suffer from periodontal disease, a disease of infection and inflammation, than any other chronic disease in the world. Yet most people don't even look at them as diseases.
So let's talk about that. Tell us a little bit in more specifics about what that connection is.
When you think about periodontal disease, it is a disease of infection and inflammation. So you have increase in bacterial load, gram-negatives. You have breakdown of bone and connective tissue, which is driven by chronic inflammation. And if left untreated, you can lose a tooth. You also can get those bacteria get into the bloodstream. And when they get into the bloodstream, they are found in atherosclerotic plaques, they're found in amniotic fluid, they're found in other parts of the body. But it's not just the infection, it's the inflammation. So C-reactive protein, which is high sensitivity C-reactive protein, is a marker of chronic inflammation in the body. And many cardiologists look at that as a risk indicator for heart attack, just as much as they look at cholesterol levels. And that chronic inflammation can come from lots of different areas in the body, but particularly in the mouth. And periodontal disease is the most common chronic inflammatory disease in the world. So we know that the hs-CRP levels go up in people with periodontitis, with periodontal disease, gum disease. And so that will increase your risk for cardiovascular disease by twofold, for stroke by threefold. And so I think that, those connections are there for heart disease. We know that people who have diabetes, it's a two-way street. They're at greater risk for developing periodontal disease. So it's considered the sixth long-term complication of diabetes. But that also people with periodontal disease, when you follow them for 20 years, they are at much higher risk for developing diabetes, because chronic inflammation really impacts insulin resistance. And if you have diabetes and you have untreated periodontal disease, it becomes very hard to control your blood glucose levels. And if you think about it, if you had in a diabetic an open wound that bled, right, that had pus coming out of it, it's a big deal, right? Especially in the extremity, you could lose a leg from that. But yet there are many people with diabetes who have this in their oral cavity, and everyone ignores it. But it has the same impact on them, right? It's not any different. And so there are many studies that have shown that people who have periodontal disease and have diabetes, it increases their risk for developing other long-term complications. The other connections, the well-known ones are, we just talked about cardiovascular disease, diabetes, respiratory diseases, people in nursing homes who are laying down with bad oral health. They're more likely to develop pneumonia, and they can die from that.
We'll be right back with more from Dr. Maria Ryan. And when we return, we'll dive deep into how oral health specifically affects women throughout our lives, from pregnancy to menopause. Let's talk a little bit about those adverse pregnancy outcome potentials, and then we'll talk a little bit more about different scenarios in women's health.
Yeah. So I would just say in women's health throughout our lives, we have a greater risk for developing oral diseases because of fluctuations, hormonal fluctuations that occur, during puberty, during pregnancy, during menopause. If you think about pregnancy gingivitis, which is inflammation of the gums, around the teeth, that happens in about half of pregnant women. And it can happen also in women using oral contraceptives because that mimics pregnancy, right? Now, women who have really, really good oral hygiene and no gingivitis before their pregnancy are less likely to develop pregnancy gingivitis. And so it's important that women before they become pregnant have good oral health. And that certainly if you have poor oral health during your pregnancy, it should not be treated later on. It should be treated at the time. You cannot leave infection and inflammation throughout pregnancy. And particularly if they have periodontal disease, this can increase their risk for adverse pregnancy outcomes like premature rupture of the membranes, contractions. All of that is related to inflammatory mediators and enzymes that are elevated when people have very bad periodontal disease. And in fact, sometimes, the inflammation, the pregnancy gingivitis can lead to things called pregnancy tumors, which look pretty scary. And they usually resolve after pregnancy, but if not, they have to be resected. But it's not cancerous. And if you think about preterm low birth weight, that's 10% of all pregnancies, I think, in the U.S. Can lead to preterm low birth weight. Yet for many of them, I'd say 20 to 50% of them, they don't know why someone is having this issue. One of the biggest risk factors is already having preterm low birth weight. You're at greater risk. But there were a number of studies that were done in the dental profession that started looking at the impact of periodontal disease on preterm low birth weight. And in fact, one of those studies that was done found that, it could significantly increase your risk of having a baby early. And that when you treated periodontal disease, that you could reduce the incidence. One study was done at University of North Carolina by a colleague of mine, Steve Offenbacher. He showed the incidence reduced from 10% down to 1.8% by providing periodontal therapy. And because of all of this data, many insurance carriers now will cover periodontal therapy for women during pregnancy because it can significantly reduce healthcare costs.
Absolutely. And when you talk about periodontal therapy, are you talking about antibiotics?
It may or may not include the use of antibiotics. Very often we can manage the disease without the use of antibiotics. So what happens is as you move from gingivitis, which is a reversible form of gum disease, to periodontal disease where you have bone loss and loss of connective tissue attachment, you develop what are called pockets. So when you go to the dentist, they take a probe and they go around.
Right.
And if those crevices go from 2 millimeters or 3 millimeters to higher, like 4 to 10 or 12 millimeters, it depends, how much bone loss you have, then you have what's called periodontal disease. And there, if left untreated, eventually the teeth will become loose and they fall out, right? So we can treat that. We can prevent the progression of disease by non-surgical procedures, which is scaling and root planing, which is removing the bacteria and the calculus and all the things underneath the gum line and letting it heal up. And sometimes we have to use antibiotics, depending on the patient and depending on the severity of the disease. If the pockets are very deep and a person can't maintain it by brushing and flossing and rinsing and doing all the things we do for preventive strategies, then we do surgical procedures. So we can either try to regrow the lost bone or we can move the tissue down so that they can maintain it. So there are a number of things that can be done to try and help people to manage the disease.
That's fascinating. And then moving, it's interesting. I was just thinking again, my own experience. My first cavity was when I was pregnant with my first child. So,
well, it's an old wives' tale that with every pregnancy you lose a tooth. And I used to tell
I didn't lose anything.
I used to tell my patients it doesn't have to be that way. And they would say, my mother told me that's why I lost 3 or 4 teeth because I had 4 children. And I'm like, well, that it doesn't have to be that way. So
exactly. That's funny. And then as we move on to perimenopause and menopause, what are some of the changes that occur there?
Well, it's interesting. When you move on and now you have your estrogen levels are decreased, you are at greater risk for bone disease, right? So people are at greater risk for developing osteopenia, osteoporosis. Well, bone is everywhere in your body, including what holds your teeth in your mouth. So you can imagine that if you are osteopenic, you become osteoporotic, that you're also losing bone here. So you're at greater risk for periodontal disease. Also, as we age, a lot of women get drier mouth. They get drier everything. And so if you think about it, when you have dry mouth, you're at greater risk for developing cavities, right? Because it's the saliva that kind of protects the teeth, rinses, off a lot of the debris and bacteria. In fact, one of the constituents in saliva is a great natural protectant of the teeth, arginine, which is an essential amino acid. It keeps a balance in the pH in the mouth. It encourages the bacteria that allow for a more basic pH and prevents cavities. So if you have less saliva, you're going to be at greater risk for cavities. A lot of women will complain of burning mouth syndrome, and they're like, their mouth is like it's on fire. Just like we get hot flashes, their mouth it's burning mouth syndrome. And that can be related to the dips in estrogen and can be resolved by giving, hormone replacement therapy. And it's interesting to see that in talking with my friend, the cardiologist, when you have osteoporosis or osteopenia, your CRP levels go up. So that's why women during menopause can be at greater risk for cardiovascular disease. So if you add on to that periodontal disease, which is also driving up CRP levels, then it's like a double whammy. If you have really bad breath, because what happens when you have chronic inflammation, it's pus coming out of the pockets. That's why people don't, if you had it anywhere else in the body, you'd have pain, right? But because you have these, it's the only discontinuous lining in the body is where your gums meet your teeth. So if you get infection there, it can just come out into your saliva. So very few people will actually get a big abscess, usually from cavities, not from periodontal disease. But you can get it from periodontal disease if the exit gets clogged up. But because it can just come out of those pockets, most people don't know they have the disease. They don't have pain or discomfort or swelling until it's too late.
And you talked about potentially using hormone therapy. Do we know that hormone therapy in perimenopausal women slows down some of those oral issues as well?
Yeah, there have been papers that have been published on the impact of it on helping to better manage periodontal disease, and also in helping with that burning mouth syndrome. But we also know that women who become osteoporotic take drugs like bisphosphonates. There's something called bisphosphonate-related osteonecrosis of the jaw. So if you are going to be taking bisphosphonates, you should have really good oral health before you start. And certainly, if you are taking them, you need to let your dentist know, because we have to be more cautious with procedures, surgical procedures, extractions. And, for some of these patients, they really develop these open lesions that are difficult to manage.
There are a couple of threads, so let me go back a little bit. Should someone who knows that they have osteopenia or osteoporosis make sure that they tell their dentist that? Will that make a difference to them?
Yes. Because
even if they're not on bisphosphonates? Yes.
If you have osteopenia, osteoporosis, you should let your dentist know. And I'll give you a story about me, right? So I still have it, GERD, right? Mm-hmm. So I was put on a proton pump inhibitor. And at this particular time, my father was very ill. He passed away from cancer. He had esophageal cancer. What else was going on? I had that and that. And I went to the physician and they said I was osteopenic, right? And so all of a sudden I started seeing that I had oral health problems. So I said, oh my God, what is going on with me? So I went to a colleague of mine, a male colleague who's a periodontist, and we all worked in a practice, one next to each other. So my assistant was actually his assistant as well. So she knew me and the kind of work I do, and she knew him as well. And so I went to see him, and he goes, oh yeah, you're having problems. So the first thing he did, and this is the problem sometimes in dentistry, is he said, oh, you've got to clean your teeth better. There's no way. I mean, my teeth were spick and span. So he's talking to me about flossing and rinsing and brushing, and I'm thinking, are you serious? And my assistant was like, oh my God, she's gonna explode. Right. So I'm like, okay, so you do see what I'm seeing though? And he said, yes. And so he gave me a cleaning, he took care of everything. And I said, something else is going on here. So I ended up calling up my primary care physician, and I said to him, Bill, something's going on here, and he said, well, you're under a lot of stress. Stress is one of the risk factors for periodontal disease because of your dad. He said, you're taking proton pump inhibitors. Let's draw the bloods, right? So my vitamin D level was non-existent. Now there are papers out. This was many years ago when I had this issue. There are papers out now that talk about when your vitamin D levels are low, your bone, you have greater risk for periodontal disease, osteopenia, etc. So he put me on prescription level vitamin D to bolster my vitamin D levels. So we got that taken care of. And then, of course, I got over my stress, and suddenly I was fine. But you can't just look at it as it's a hygiene thing. Same thing. I just did a recent interview talking about mental health and oral health, and I had a patient who came in, had very, very significant decline in her oral health. My hygienist said to me, you got to come and see. Like from 6 months ago, she just is a different person. It looks terrible. And I said, did you ask her if she has diabetes? Because that's one of the major ones. Someone develops diabetes, we see significant changes in oral health. And she said, no, that's not the problem, et cetera. And I went in to talk to this woman, and I asked her, is there anything going on in your life? And she started talking about her divorce. She was crying and everything. She was so upset. And I said to her, your stress levels are this high, and it's showing up in your mouth. So you need to, work on how you're going to address this. And if you need counseling or whatever, I mean, we don't do that part, but you need to go see, your physician and, talk about this, because if I'm seeing this here, God knows what else is going on, right? So I think that, this is a window. I used to work with ophthalmologists, and they used to tell me they could see in the eyes if someone had cardiovascular disease. They can see a lot from the eyes. The same thing as the mouth. You can, when you start seeing these changes, something else is going on. So I think it's really important for dentists to know when you need to refer and not just talk about brushing your teeth more. So on both sides, we have to really think about this.
So talk to us a little bit about what we need to do to have what's considered good hygiene.
Yeah, good hygiene is essential because most of the diseases we're talking about in the oral cavity are preventable if you reduce your risk. And one of the biggest risks is poor oral hygiene. And so you need to use a good toothpaste with actives that really help with preventing cavities, help with reducing inflammation and bacterial load around the teeth for periodontal disease. So brushing twice a day for 2 minutes. Now, some people, I think the average amount of time people brush is about 45 seconds. So you really need to take the time to brush properly for 2 minutes. And that's why I like brushes with timers on them, because it really lets you know. Because a lot of people think they're brushing for 2 minutes, but they're not.
Sure.
Excuse
me, does it matter what kind of toothbrush?
Well, yes. I would say you don't want to use a hard toothbrush because you can cause damage if you're not brushing properly. We've just launched a new Colgate Total line with a toothpaste that's really, really good for not only cavities, but periodontal disease, and also the toothbrush that goes along with it to get in between. And then flossing is important to get in between teeth, and most people don't floss. So if you don't floss, then you use a mouth rinse, right? And even during pregnancy, when I said you have to have really good oral hygiene, a lot of people get morning sickness. And I used to say, well, if you get morning sickness, use a mouthwash, a really good mouthwash. And so as part of that Colgate Total line, we have the first alcohol-free mouthwash to get the American Dental Association seal for plaque and gingivitis. And it's a really good alcohol-free rinse. So I think that, you have lots of options on how to maintain good oral health, but it takes a bit of time. It takes time to do it. You have to spend at least, 5 minutes doing it. And some people, that seems like a long time, but it's well worth it.
Absolutely. And you had mentioned about dry mouth, and that we're missing arginine sometimes if it's due to perimenopausal reasons. Is there a specific kind of mouthwash that would help, or what other suggestions would you have for someone with dry mouth?
Yeah, it's interesting. With dry mouth, I would say that there are some mouth rinses that may relieve the symptoms of dry mouth, but also we often say that sugar-free, right, lemon drops, citrusy can help to stimulate salivary flow. Just think about when you have a lemon, sometimes, you can feel that you have increased salivary flow. So, and that's the other thing. Stay away from high sugars in beverages, especially before you go to bed. Make sure you brush your teeth before you go to bed. But for some patients, there are medications that can help increase salivary flow. But they also have side effects. They, can make you sweat more too, right? So, like pilocarpine and others that can help with increasing salivary flow. And there are other medications as well. But sometimes it's just making sure you're hydrating well, drinking lots of water. And there are some mouth rinses that seem to perhaps alleviate some of the signs of dry mouth. And so, we actually are working even on a toothpaste that has arginine in it. We actually have one on the market that is for sensitivity. It works very, very well. It's from Tom's of Maine. It's sensitive relief toothpaste, but it's got 8% arginine in it. And so many years ago, when I was an academic, the chair of my department, he did a study looking at people who had a lot of cavities and people who had very few cavities. And he took saliva and he looked at the saliva of the two groups. And the biggest thing that stood out that was different in the two groups was the group that had very few cavities had lots of arginine in their saliva. And so he recognized that was a natural way of preventing cavities.
You mentioned sensitivity, and it reminded me that that's an issue for a lot of people. Do you want to say something about that? Is that a harbinger of something, or is it just the way it is for some people?
I think, sensitivity comes because you have exposed tubules that allow for heat and cold, particularly cold. If you're sensitive to cold, that's the most common. Mm-hmm. When you become sensitive to heat, it could be other issues that you're having as well, but cold is the most common. And that allows it to transmit into the nerve in the middle of the tooth. So you can block those tubules with certain toothpaste that enable you to do that. Now, as you get older, you can get recession, so your gums kind of move down, right? And you have a little bit of the root exposed, and that's where you're more likely to get that sensitivity. And so as we age, many people,
another fun thing.
Yeah, another fun thing. Yeah, but we have solutions for it, so it's
there you
fun.
Go. And speaking of solutions, you talked a little bit about some new technologies, some new products. What are you seeing either in the dentist office or in the lab that may be coming to us in the next 5 to 10 years that might really change things in terms of dentistry?
Yeah, I think that connected technologies is really going to empower people to do a better job at home and enable us as practitioners to see how they're doing. And we had a project which we started with Apple a number of years ago where we had a connected toothbrush and we could determine how people were doing at home. And then we could counsel them if they weren't brushing enough or if they were having issues. And so that enabled us to get oral health into the Apple Health app, which is also, once again, making that connection, right? About the importance of oral health to overall health and well-being. With COVID came telemedicine, really grew. Yeah. Teledentistry grew. And now we can actually use the phone to look and determine and at least get an idea. Does someone have oral health issues? We can screen. We can, let people know you need to see a dentist. That doesn't look right, So I think that the phones will really change our ability to connect with consumers, to connect with patients. I think that's another big area. I'm really excited about a project we're doing with Verily Health, where they were deeply phenotyping people with diabetes and cardiovascular disease, and they were not looking at oral health in that patient population. And so we decided we wanted to work with them and look at the oral health and better manage it with intensive periodontal therapy, non-surgical periodontal therapy, so that deep scaling and root planing every 3 months, and intensive home care using connected technologies, using texting to encourage people to have better home care, and advising them, going back and forth, educational programs for them, etc., to improve on oral health literacy, which is pretty low. So we were able to do that. And next year we'll be coming out with the results, not only on could we improve their oral health, but did we move the needle for their systemic health? It's looking at both sides of the equation, the oral side and the systemic health side. So, co-locating dentists with physicians. I just went to a practice in it was in Las Vegas. I went to the health meeting, the HLT.
That's right. Yeah.
And one of our partners Pacific Dental Services, which now calls themselves PDS Health, has integrated dental and medical practices. And it was so cool to go and speak to the physician, and I'm walking down the hall and there are dental chairs. And I'm thinking, if I'm a patient and I'm going to see my physician, I'm going to ask, why are there dental chairs here? And that physician says, because your oral health is so important to your
Absolutely.
overall health. So you can get treated by the dentist here too. And when I used to do work in adverse pregnancy outcomes and diabetes, cardiovascular disease in the hospital, initially when we did those research projects, the patients would have to drive across the street to the dental school.
Right.
Many of them didn't make the drive. When I put the dental chairs in the hospital, they came. So
Sure.
I think that kind of connection is going to really change the way we all practice. And I think that's very exciting as well.
So we just need to figure out how to incentivize that.
Yes. It's
That's
true.
part of the challenge. You've been so generous with your time. Just a couple more questions. We started out with talking about your journey and your trajectory, and you were the first woman to win the Victress Award for Health. And from what I understand, the Victress Award is very much focused on increasing the percentage of women in leading positions, as you are, but also inspiring young people in their careers. And so what are some of the things that you would want to tell those women that are coming in behind you that they could use in terms of charting their own trajectory?
Yeah, it's interesting. I would say that when I first graduated from dental school, maybe there were 20%, 30% women in a class. Now there's 60, 70%. I think it's same thing in medical schools, right? I think we're seeing the same changes, that more women are graduating than ever before. Yet we do still find that many women are not the chair of the department, the dean of the school, the head of the society. And so we're still working on getting to the next level there. And I believe that the only way we're going to do it is we also have to support other women who are coming up the ranks. And of course, you need mentors, not only female mentors, but male mentors, because it's part of the trajectory. And also you need the networking to be at the table, right? And so I remember when I applied for my first academic position, I was the first tenure track woman that had ever been there. And, and it was not, this is in the, let's see, what year, in the 90s. And I thought, this is crazy. There's never been a woman who has been tenured here, who has become a full professor, a chair of a department. No. But I felt really good when I left the institution that we had made major strides and we had moved ahead. But that only happens when you really support others who are coming in behind you. I had gone to a program called ELAM, which is Executive Leadership in Academic Medicine, where you needed to have the business side of running a school, running a department. And very often, women didn't have that piece of it or the mentors for it. So, I think we're very good teachers and clinicians and all of that, but in order to move up in the ranks, you need the other elements. And I think we have to support each other. I think that's really important.
Absolutely. Well, before I let you go, what did I not ask you that you wanted to make sure you told our audience?
I don't know. You were very thorough here.
Kind of like a teeth cleaning.
But I just think that the last part I would say is, I think I mentioned it earlier, is that oral health literacy is quite low. Health literacy is not great, and you mentioned you have to advocate for yourself. So you can't advocate for yourself if you don't know. So one of the things that I'm really also very proud of that we have done is we have created some programs to educate children at a very young age about the importance of oral health through their teachers and their parents, thereby educating their parents as well.
Right.
It's called Bright Smiles, Bright Futures, and we've reached 1.7 billion children over 30 years through
With
that.
a B?
With a B. 1.7
Wow.
billion, yes. So I think it's really important. The younger you start, the better. But there are many people who are older who don't know. So we started a program called Know Your Oral Health Quotient, which you can find at www.knowyourOQ.com. It's a 10-question quiz you take just to find out, like, your IQ or your EQ. What's your OQ? How much do you know about oral health? And it's very interesting because a lot of people don't know a lot. And when they retake the quiz, they do much better. So we actually, I'm a scientist. We always have to do a study. So we did a study to look at, does this change people's knowledge, attitudes, and practices? And it does by increasing their knowledge.
Well, Dr. Maria Ryan, I know I learned a great deal. I know that our audience will as well. Thank you so much for spending time with us today.
And thank you for having me on your show. I really enjoyed it.
Thank you. Thank you again to Dr. Maria Ryan, Executive Vice President and Chief Clinical Officer at Colgate Palmolive. I hope this conversation has changed the way you think about oral health, because as we've heard, it's not just about the teeth. From pregnancy to perimenopause, from cardiovascular health to diabetes, what's happening in your mouth reflects and impacts what's happening in the rest of your body. You can start attending to your oral health today by asking yourself, when was the last time you had a dental checkup? And even if it's been less than a year, don't ignore bleeding gums or persistent dry mouth. And if you want to test your oral health knowledge, take the Know Your OQ quiz at KnowYourOQ, that's KnowYourOQ.com. As women, we can make healthier choices for us and for our families. So after you review your own oral health, make sure your family members are also getting the care they need. As always, thank you for joining me. Take good care and don't forget to floss. Our episode was produced by Patrick Shambayati and me, and our associate producer is Kyla McMillian.